Good afternoon, everyone. Welcome to the new WIC Director's Orientation. Could those of you on the phone identify yourself, or on the line identify yourself? I think we have Jessica from Northeast, Colleen from Rio Blanco, Jennifer from San Juan Basin, Jennifer from Broomfield, and Lori from Montezuma. Is there anybody else that has joined us?
This is Elizabeth from Uray County.
Perfect. Welcome, Elizabeth.
Kristen from Montrose County.
Perfect. Thank you. So what we're going to do is have a couple of different presentations. Patricia is going to give us an overview of WIC, and then followed by Katie talking about fiscal administration, and then Mitch Mize on CISFA administration. At the end of each of their presentations, if you have some questions, they can answer those questions at that time. And then at the end, we also have 15 more minutes for some wrap up and questions. So feel free to type in your questions if you have them now, or you can wait and ask them a little bit later. So I'll turn the time now over to Patricia. Let me take these two. Welcome, everybody. So this is exciting. I think this is the first time we've attempted new director orientation via the web, via the internet, and not in person. So we also plan on recording this, so hopefully it would be available for a while for others, because we realize that in part, when we do have these orientations, they don't always hit exactly when people need them. So hopefully, I know some of you have worked with WIC longer than others, but hopefully you're going to find information today that's helpful for all. So again, the overall goal today is to provide information important to you as managers of your local WIC programs that isn't otherwise provided through our general new employee training. I will be providing an overview of WIC, how it fits in with other USDA-funded nutrition assistance programs and with other public health programs in Colorado, and describe how the WIC state office functions. And again, I think I should have introduced myself more fully. I know you see from the agenda, I'm Patricia Danilek, and I think most of you know I'm the state WIC director. When I'm through, again, as Kathy already mentioned, Katie Gazowski will be reviewing items of importance for fiscal administration, and Mitch Mize will be discussing the WIC statewide computer system, Compass. So again, as far as an overview for the program, WIC is one of 15 food and nutrition assistance programs administered and funded by the U.S. Department of Agriculture. The largest of these programs is SNAP, which is formerly known as food stamps, all the child nutrition programs, the largest of which is school lunch, and WIC. In Colorado, these programs are spread for administration across 3 different state agencies, and in most counties, they're provided to the public through different local agencies, and probably a little differently in all of your counties. But again, many times people aren't aware how many food assistance programs there are, and that WIC is really only one of several. WIC was created in the 70s as a targeted and tailored nutrition assistance and education program designed to both prevent hunger and malnutrition and promote optimum growth and health for pregnant women and their young children. Its connection to public health and inclusion of health screening and one-on-one counseling are unique among food assistance programs, as I'm sure you're aware, those of you that are familiar with the other programs. The WIC program started in Colorado in the late 70s and has had statewide coverage since the late 80s. Unlike several other food and nutrition assistance programs, WIC relies on an annual allocation of funds from Congress to operate. Many of the other programs are known as entitlement programs, meaning that all who apply and are eligible must be served for those programs. So again, we rely every year on a separate allocation of funds And for many years, we've been fortunate that enough dollars have been provided to WIC for really all states in the country to serve all who are eligible and interested. But it is always possible that this will not be the case in some years, and that waiting lists may need to be started. And it's not something that we've had to employ for many years, but there was a scare, if you will, as some of you might have been aware of in the spring, with sequestration, and when we finally got word of our current fiscal year funding. Fortunately, in the end, enough funds were found to make it possible to serve all participants in Colorado and actually across the country at this point. But again, it's probably important to understand that that is a fairly unique feature of the program. I'm sure Katie will be explaining more about the implications for you as local agencies and how the funding comes to you every year. WIC is a very prescriptive and regulated program, as I'm sure several of you have found. And maintaining the integrity of the program, in part through application of those many rules, is part of our job as state administrators of the program. We are, however, equally responsible for assuring access to the program for all who are interested and eligible. So by integrity, we really don't mean to keep services away from people, but both to balance the needs of integrity and adherence to rules, and doing what we can to be as flexible as we can within those rules to provide services to the maximum number of people eligible and interested in the state. And certainly by working with you as local partners for those outreach efforts, and to see that it's a constant balancing act at your end to take the resources that are available and make those go as far as possible to provide the services to as many as are interested in your counties. Again, through USDA, which is our funder, we in the state office most typically interact with people at the regional level of USDA, and our regional office is right here in Denver. So those are largely the people that we look to and who actually monitor our work. So now let's move to talking more about the state level for the program. WIC is part of the Nutrition Services branch of the Prevention Services Division of the Department of Public Health and Environment. The Prevention Services Division is one of several divisions on the health side of our department, and you all, in some cases, I'm sure, interact with some of those other folks. For instance, one of the other divisions is disease control and epidemiology, and within that division is the immunization section, which I know many of you interact with or work with. Another large division is health facilities and their oversight of facilities such as nursing homes. Another is the laboratory services, and another is health statistics and the group that deals with biostatistics and other data. So the Prevention Services Division, again, which is where we're housed, contains many other programs that you are probably familiar with at the local level. Other of the programs here in our division include all of the maternal and child health programs that you deal with, again, in a variety of capacities through some of the women's health programs, child health programs, and the healthcare program for children with special healthcare needs. We also work with the family planning program, and another whole large group in our division of folks that work in chronic disease prevention, such as smoking cessation programs, cardiovascular disease, diabetes prevention programs, and obesity prevention. So now I'm going to talk specifically about our branch, the Nutrition Services branch, and our part of the division. So WIC is actually only one of two large programs in our branch. It is the largest, and I serve as both the Nutrition Services branch director and the WIC program director. To the, I guess it would be my right side of the chart you'll see that the Child and Adult Care Food Program is the other large program, other than WIC, that we have in our branch. The Child and Adult Care Food Program is a sister program, if you will, to school lunch that provides reimbursement for healthy meals served in child care settings. They are a good complement to WIC in that we both serve the early childhood population. You'll also see to that side of the organizational chart that as of not that many months ago, we also now have an early childhood obesity prevention unit. Tracy Miller, who also is paid partly by WIC, so she interacts with many of the local agencies as well, is heading that effort for early childhood obesity prevention. And just as of recently, Jennifer Delaporte, the breastfeeding coordinator for both WIC and the division, is housed in that unit. Coming across then to the other side of the branch, you'll see at the top, again, that Mitch Mize, who will be speaking later today, is the Administrative Services Manager for the whole branch. In that capacity, he oversees several of our other units, including the Benefit Delivery Unit, with Cheryl Castle, that many of you interact with, for authorization of our grocery stores and retailers, and also our IT staff that keeps our computer system working, and also oversees our fiscal unit that Katie is the manager for, that oversees fiscal operations for both WIC and the Child and Adult Care Food Program. And then finally, you'll see there the unit that you all actually interact with the most, which is headed by Lynn Ireland, and it's the nutrition unit, where the nutrition consultants that you all interact with the most from our office are housed in that unit. About half of their jobs are the technical assistance that they provide to you as local agencies, and the monitoring and oversight function that they provide. And then otherwise, they all have different lead areas for the many different nutrition education and other nutrition-related projects that we have going on in the office. So that gives you an idea of what our group looks like, and the names themselves of the folks in our office that you interact with, more or less, depending on the questions or interactions that you may have. So then finally, I would just mention that, again, that we interact with many others in our division, and largely right now, a lot of that is around obesity prevention and our early childhood obesity efforts and breastfeeding promotion efforts. Other examples are the recent family planning training that was provided in our coordination with them. And another example is work that we do with our oral health unit in providing good educational materials on oral health. Finally, before I end, I just wanted to mention too, I believe some of you are familiar with the National WIC Association. If not, I encourage you to look at their website and also consider joining as members or local members of that association. Right now, we're fortunate in that Kathy Baker is serving on the board of the National WIC Association as a regional rep for the nutrition section of that association. But again, I'd encourage you to look at their website. They've got lots of great information that keeps us all very informed about WIC at the national level. And then finally, of course, I think many of you are familiar with our local Directors Association. Several of you that have been around long enough hopefully have been able to participate in their meetings or monthly calls. We typically interact with the group about 3 times a year in person at meetings, and otherwise through monthly calls with the directors group. And again, if you aren't already involved with that group, I would encourage you to be involved. I think it's a great way to stay informed and learn from your peers as to best practices and other things that are going on at the local level. So at this time, I'll see if anyone has questions particular to my section before we turn it over to Katie to review fiscal administration. So I don't hear any questions at this point, so I'm going to move from my chair and Katie will join me.
Okay. Good afternoon. I'm Katie Gazowski. I'm the fiscal manager for the WIC program. And I will talk to you today, kind of provide a broad perspective of fiscal, all the rules and regulations that go along with the WIC program. Again, I'm just going to do kind of an overall broad perspective, so that if you have specific questions for your local agency and want to talk later about those directly, I'm certainly glad to do so. But please feel free to bring up your questions at the end of my section if you have something specific to today's discussion. So just to give you an idea about the roles and responsibilities of the fiscal team here at the state office, we work predominantly with budgeting and the funding formula that goes, how we distribute the funds directly to the local agencies, contracting, so the contracts that you receive come from our unit, compliance with federal rules and regulations, not only with the fiscal purchases and activities that we conduct here within the state office, but also at the local level, making sure that what you're submitting to us, the costs are appropriate and necessary. Federal reporting, USDA requires quite a few monthly, quarterly, annual reports that our department specifically works on. Fiscal monitoring, we every 2 years monitor each of the local health agencies. Cyril Padilla and myself will travel around the state or conduct them here, depending on how large of an audit it needs to be or monitoring it needs to be. But we do that every 2 years, and so in addition to the program monitoring that you receive from the nutrition consultants, our unit also works on the fiscal side. The staff within the fiscal unit pertaining to WIC are Cyril Padilla, who she works predominantly with your contracts, your invoices for reimbursement, fiscal monitorings, and then Katie Roby. So not to confuse you, but both Katies that work at the state work within the fiscal unit. So Katie works directly with, she'll provide you your monthly caseload report, breast pump orders, any check issues that you might experience, that your retailers might experience. She's the person that you would want to contact on that. And she also works with our rebate that we submit on a monthly basis to Mead Johnson, who is our infant formula manufacturer. So to give you a little bit more perspective on how the federal funding cycle works, as Patricia had mentioned a little bit about how Congress works, in a typical year, we usually have an estimated budget by fall, which is the amount of money that USDA really tries to get our funding up to during the course of a federal fiscal year. We do operate on a federal fiscal year, which is October 1st through September 30th. It doesn't always coincide with your accounting year, it doesn't coincide with the state's accounting year, but that's how our funding is awarded and how our funding has to be tracked. In the early spring, budget is finalized by Congress and the President, typically, and then USDA will then apportion, based on their funding formula, how much funds will come to the state of Colorado. Let's see. Basically, our funds come in two means. We get funds for food, and then we get funds for administration, or our NSA funds. And our food funding helps, it covers all the costs of all the checks, all the participant benefits that we issue through the local agencies within the states. And then that also covers our breast pump purchases that we make within the state. And then our NSA costs cover all of the expenses that we have here at the state office to administer the program, and then the funding that we provide to the local agencies to administer the program on the local level. In addition, the other funding that we do receive on an annual basis, I briefly mentioned before, is from our infant formula rebate. So we get about $1.5 million a month in formula rebate that goes directly to food. It's a supplement to the food that we receive, money that we receive from USDA to cover the costs of the participant benefits throughout the year. Funding formula, and so then once we receive our money from the federal government, then we appropriate about 85% of that funding directly to the local agencies. I say that this is typically how the process works, but in the last couple of years, we have not had a typical year to kind of pull from information because of sequestration, the threat of sequestration in the last year and possibly this year. We don't know exactly what that's going to mean in terms of what our funding looks like. We estimate every year, we spend a great deal of time within the fiscal unit trying to estimate what we think funding is going to end up being, what we project our food needs will be, what we project our caseload's going to be. All of those are key factors in determining, how much, do we need to do cost containment measures to make sure that we that our average cost per food package that we give to local agency or to give to participants, that's within a certain amount according to the federal government, or is there a way that we can reduce that to make our food dollars stretch more? We spend a lot of time trying to project that. So within the state office, we create basically a budget. We give, and then we plug everything into a funding formula to give to the local health agencies, and which is probably what you're most interested in kind of getting a little better understanding about. When hopefully, and I don't know, we have kind of a variety of personnel here on the phone. Some of you have been with your agency for at least a few months. Some of you are very, very new. But in submitting the funding for this year and the funding formula results from this year, we included a copy of the presentation that looks like that. It's just the federal funding overview. I'm not going into detail on all of that today because it would take a little bit longer than we have. But it does detail every single column and formulas in each of those columns, so you can get a better understanding of all the components that go into the federal funding formula itself. I will touch on a very, very high level, just to give you an idea of what we do take into account. The funding formula was created, it was about 8 to 10 years ago, I believe, as a chart. Excuse me?
Do you want to show the chart?
You can. You can go forward a little bit. I'm not going to go through all of it. Yeah.
Oh, because I have your charts too. If you want to show it.
Oh, you can if you want. That's fine. Anyway, the funding formula was created about 8 to 10 years ago as a means to objectively administer the funds that we have to the local health agencies. And there's 39 that we work with here in the state to provide that. And so this is the funding formula that was sent out this year, the results of the funding formula. We take into account a variety of different components because we recognize that it's not a one-size-fits-all. You have a variety of communities within the state, and you all have very different needs. So we didn't want a one-size-fits-all formula to distribute the funds that we have available. So we take into account caseload, and that's probably the largest component of the driving factor of the formula itself. And amongst that, in addition to the caseload, we look at your salaries and your FTE within your local agency. Every December, I will be sending out a notice to have you submit a salary survey to us. It's an extremely important form for you to fill out. That's where you project how many people will be working in your program and what their salaries and benefits are for the coming year. But that information gets plugged directly into the formula. We use that for comparing you between like agencies. It gives us an idea of how much your agency has to, some agencies have to pay more, a premium amount for the same type of personnel just simply because of the location you're in the state. But by taking those kinds of things into account, it does factor into the funding formula. And in addition, we look at your turnover rate, because we recognize that it costs more to serve to do a new certification than it does to do a recertification. We take into account the high risk participants, the percentage of high risk that you work with, because we recognize that it also costs more to have to do a high risk appointment versus a non-high risk appointment. And for smaller agencies, we take into account travel that you might experience between clinics, because that can be very, very expensive for some of the smaller clinic, or for the smaller agencies as well. And then economies of scale. How efficient are you able to be with the clients that you serve? And, you know, are there ways that, you know, you can serve more with fewer personnel? And we do look at all of that information. We plug it into one giant formula. And this year we estimated, our best guess was that we'd have about 7% less funding overall to work with. 5% because our caseload overall has dropped in the state. That's just a reality that will factor into the funding that we do receive from USDA. The other 2% is our best guess of, you know, an impact from sequestration. We could be right on, we could be getting more funds than we anticipated, we could be getting less funds than we anticipate, but that was our best guess for the year. So we plug in a figure that's 7% less than what we had last year, and we distribute funding based on that dollar figure. In the spring, if we are able to give more, or if we have to take further cuts because our funding was less, we'll make those adjustments at that time and rerun the funding formula with current caseload information and current salary information. Let's see, that brings us up to contracts. To give you an idea, typically we set up a 5-year umbrella contract with each local agency, and it's just a big, thick document that you get, which we started last year. And then every year we do an amendment to that contract to add more money. It's pretty much the same scope of work. We have 2 other types of documents that we were able to add into this 5-year cycle. One is a grant option letter, which aside from this year, you'll start getting those every year. That basically states that we want to extend the option of doing your contract for 1 more year, and we would add funds to your contract based on that. A grant funding letter is where in the middle of a year, when we get our funding from USDA, for instance, and we find that we can add money to a contract or take money away from a or we have to take money away, we do a grant funding letter, which is strictly changing the funding available in that contract year. Both the grant funding letter and the grant option letter only require signatures on our end. So we don't have to provide, you don't have to take it to your board of directors and get those types of documents signed. This year, however, within the last week, we just sent out contracts. So if you didn't get yours and you need for us to resubmit that, please let me know. Cyril just sent those out here in the last few days. You got what's called a contract amendment. We weren't able to do a grant option letter because we had to change some of our scope of work language, which is just detailing what the program is that you're signing up for. We had some changes at the department that required us to rewrite that scope of work. So you should, that you will have to run around your department and get signatures for. So please be sure to do that. And if you have questions about it, need clarification, please give myself or Cyril a call and we can walk through that with you. But that's typically how the contracts work. We do need those contracts back by the end of August so that we have time to get those routed around our department for signature, and then they will be effective as of October 1st. Monthly, you will get caseload reports from us that just details what your budgeted caseload was versus what your actual caseload was. You can also pull caseload reports directly from Compass. This is just a compiled report of all the local agencies' information, so you can see how you compare to others within the state. But you can always pull that information yourself and pull that per clinic, your clinics, if you want to get down to that detail. So basically, the fiscal administration part, and you can bring it back part of the manual if you'd like. And the fiscal administration portion of the program manual is very short. The reason it's short is because most of the fiscal rules and regulations that apply to any federal funding source are available through the OMB Circular 87 or 122, depending if you're a nonprofit agency, you would go by the A122. Those dictate what kinds of funds or what kinds of expenses are allowable from a federal perspective. But this program manual provides just some, well, let's see, it's section 5. So, of the program manual is fiscal administration. It's gonna be the other way. So bring it up. It gives you something to look at other than me.
There you go.
But, and I'm not going through this in detail. I just wanted to point out in general, some of the information that's available for you through this section of our manual. This outlines the types of costs that are allowable for you to submit to the state office for reimbursement. The most important, the direct costs, salaries and wages. Please make sure, if you remember nothing else from this presentation, that you need to make sure that the time that you charge us for your employees is actual time and not budgeted time. So you can't just say, well, she's going to work around 20 hours a week, so we'll charge 20 hours a week. It has to be actual time that's documented in a timekeeping setting. So whether you keep track of that in a paper time sheet or you do an electronic program like we have Chronos here at the state, you need to make sure that those are actual hours, that you record the time worked, the time taken off for leave, sick, holiday, and that both the employee and the manager approve those timesheets. So most agencies, I believe, have those types of have that set up already, but just be aware of that as directors, that you need to make sure that that's a really crucial piece. Some of the other items, direct costs that are allowable: supplies, nutrition, education, and breastfeeding promotion materials. If you could please, if you ever do need to purchase something for those types of activities, make sure that those are spelled out separately on the invoice form. We do report on an annual basis to the USDA how much we have, or how much we spend on those types of activities, and we are required to spend a certain proportion of our income that we get from them. So we just need that in there. Equipment. If you need to buy equipment over $500, you need to get approval from us. So just write a quick email to me and I can respond, and then just keep that with your file. And it's fairly simple. It's usually not an issue. It's just a requirement of the program. So please remember to do that. The invoice form that you submit to our department does not need to have a backup documentation attached, but you do need to make sure that's kept at the local level. Keep that in your offices. That backs up all of the expenses that you're charging us for. Because again, when we come out to do our fiscal monitoring visits, when you get your A133 audits, which is a federal audit, not all of you are subject to that, but those of you that are, you have to prove to the auditors that you have legitimate expenses. So just make sure you keep all backup documentation on hand. And again, there's some detail about a few of the other expenses, indirect expenses. Your fiscal department will really help you out with this type of information, but if you do, just know that you need to have an indirect cost proposal on file with the department for us to be able to pay you indirect costs. So most of you do. We do limit how much you can charge us for indirect, and that's mainly because we have agencies out there that could charge, that have an approved rate of up to 70 or 90%, and it's really our intention that the money that comes from USDA is used for direct services as much as possible. So that is the primary purpose behind the limitation. Let's see. Time study data. People get this confused all the time with the time and effort sheets, the recording of your time for salary purposes. But the time and effort sheet is really, what this does is that for every agency, you either submit 1 week a month or 1 month a quarter, depending on how you're set up with us. But all of the employees' time that is spent working on the WIC program has to be allocated or recorded as to how you spent that time. If it was either nutrition education, breastfeeding promotion, client services, or administration. And those percentages and that time study report needs to be submitted to us on a monthly basis or a quarterly basis. Because again, we have that requirement from USDA to provide how much we spend on each one of these types of activities. And this is how our agency is set up to gather that information. So it's extremely important that we get that report in a timely fashion if possible. Like I said, our department also, I'm not going to go into a lot of detail, but our unit really does work very closely with the benefit delivery unit on check processing and You know, the checks that you give to the participants, when they take those to the stores, there's a whole behind the scenes process that determines how much, because when you give them a check, that check has no amount on there, it just has a food prescription. So there's a whole process behind the scenes of how the amount of those checks, the worth of those checks is determined, and how we make sure that the checks that are cashed are legitimately cashed. So we do a great deal of work on there. You know, if you have questions on how that works, I don't want to overload you today with that detail, but if you ever have a situation where you voided a check accidentally, please let us know. We hope to not have that situation, but then the participant received it and cashed it. We need to know those types of things. Or if you have issues with checks, give us a call. We'll walk through that particular scenario with you. We are working at some point to get to an EBT type system, which is electronic benefits. So somewhere in the next few years, we'll be on a system where instead of giving out checks, you have like a debit card to administer the food benefits to participants. Make sure the one piece of information on your purchasing that I do recommend that you really pay close attention to at the end of the fiscal year, federal fiscal year, September to October, is a very crucial time for the type of expenditure that you might have. If you start to make a purchase in September, you need to make sure that that gets charged to the September billing and not to the October billing. So when you cross fiscal years, there are specific fiscal rules and regulations you need to follow with regard to purchases. That's probably the biggest finding that we have when we go out to local agencies is because you're not on the same federal fiscal year, it doesn't matter as much to you. But for federal requirements, if you make a purchase in September, it has to be charged to September. If you make a purchase in October, it has to be charged to the October. So please pay close attention to that when you're making your decisions, and call us if you have questions about how to appropriate a purchase made around that time of the year. Also, we will, like I said, our fiscal monitoring will be coming out every 2 years to conduct a fiscal monitoring. That process is done in two different ways, and this is a fairly new process for the department. Colorado Department of Public Health and Environment has started a new financial risk management system, or FRMS process, where we have a team of auditors that goes out to each of the local agencies and reviews your overall accounting infrastructure and how you're billing time and how you bill for all of the programs that are within the department. And then we come out separately and look just at the WIC program costs. So really, we're trying to help the local agencies by not asking all the same questions from program to program to program. We have one person gathering that main information, and then we're gathering the program-specific information. Now, that will not apply to, Jackson, and because you're a nonprofit agency, and I think that's the only one on this call today that will apply for. In your case, we will be conducting a fiscal monitoring visit that looks at everything, not just the operating costs for WIC. But we are just a monitoring visit. We just come out to make sure that the types of things that you're charging us would be appropriate, and that when you go through your own audit, we offer suggestions so that you wouldn't have a finding in those audits situations. And then our department reviews the A133 audits that you have done for those agencies that have that done, and make sure that there aren't findings associated with WIC. And that is all I really have regarding fiscal. I don't know if you have any specific questions that I can answer at this time.
Elizabeth from Uray, can you hear me?
Yes.
And you're Katie?
Yes.
I don't even know how to reach you. What's your phone number if I have questions?
303-692-2816.
And with Cyril's last 4 digits of her phone number?
Oh, Cyril's, I don't know if I have
Want me to call, you want me to call you first?
Yeah, call me first, and then I can, we can get that out to you as our phone numbers.
And when are you planning on the physical visit to Uray County?
Well, Uray, we just did, well, we'll be working on it this year, I believe.
Well, I don't want to waste other people's time on the
No,
call.
we have another year, I believe, on that one. So
Okay.
I think we're okay. And again, since we're doing this financial risk management system process, much of what we're doing is actually a desk audit. So in many cases, we're not even coming, our fiscal staff is not even going to come to your agency. We'll just have you submit those extra costs to us, a copy of them. So that will definitely be the case with your A, I'm sure. Any other questions? Okay, well then I will hand that over to Mitch for the last part.
Well, I don't know about you guys, but that was a lot of information. I'm supposed to understand it, and it still makes my head swim. So let's hope maybe I can present something a little bit simpler. My name is Mitch Mize. I'm Administrative Services Director. And I'm going to talk about some COMPAS functionality and how that affects clinic procedures and maybe some best practices. I have 7 topics to talk about, loosely related because they're all COMPAS functionality, but other than that, they're really not related. The topics are, I'm going to talk a little bit about the help desk and how that affects clinics. The second topic is synchronization and network downtime mode. Third topic is secure COMPAS user ID form, and then the importance of participant signatures. I want to talk a little bit about the MICR line on food instruments, hardware inventory, and then the last topic is intrastate dual participation. I would really say that the help desk is your first point of contact for most questions dealing with COMPAS functionality, and since COMPAS functionality is related to policy, some of the first questions you may have about policy can be answered by the help desk. So it's important to, whenever you have a question, to contact the help desk directly, and you can do that either by phone or email. And there's 2 phone numbers. One is a 303 exchange, and the other one's a 1-800. And when you leave a message, for any types of hardware support, it's option 2, and for any type of application support, it's option 3. What's displayed on your screen now is a screenshot of COMPAS, and those phone numbers and the help desk email is permanently displayed on this in Clinic Services on the System tab. You can see that up there circled in red. I don't think you can read it, but when you go to COMPAS, that's where it is, so you can find that. When leaving a message or an email, please provide the following information, and it's your name, phone number, clinic name and clinic number, the family ID or participant ID number, and a description of the problem. Make sure you emphasize that with your staff also. The help desk has the ability to remote into your computers, and this is really helpful for a couple of reasons. The help desk can demonstrate some of the more difficult COMPAS functionalities, such as custom food packages or tailoring food packages. The help desk may want to do that when they are reviewing and confirming proper configuration of the workstation and the peripheral devices attached to that. A lot of times, that's one of the first steps they'll do is they'll ask if they can remote in and check certain things. The next thing I want to talk about is really the 3 types of issues that the help desk deals with. And the first one is application issues. And again, please report all suspected COMPAS application issues to the state help desk immediately, because it can take a day, several hours to figure out what is the proper approach to fixing a problem. And I'll kind of go through that a little bit. The first thing that the help desk is trying to determine is if it's actual defect in the application, or if the application is working correctly and the end user just needs some training on the application. If there is a possible defect, the help desk creates a ticket with our system developer to investigate. If, once that investigation is done, if it's determined it is a defect, then the fix will be included in the next compass release, which may be several months away. So just understand that the help desk can't necessarily fix all problems immediately. Now, on the other hand, if the help desk determines that the application is working correctly, this is where they will guide the user through the proper steps to complete the task, and will also direct you to appropriate sections of the program manual or other system documentation for further reading and understanding. There's times when the help desk may have to escalate the ticket to a nutrition consultant, particularly if it gets more involved in policy matters. Or they may have to escalate the ticket to a level, what I call level 2 technical support. This is where a database administrator or a programmer have to fix the problem. So those are application issues. The next group is network and internet issues. This gets complicated because these issues may be something that's happening at your local agency. So as you all know, Compass is a web-based system, and it relies not only on a local area network within your clinic, but also relies on internet connectivity. And that internet connectivity is created and maintained by your county IT departments. The help desk can help determine what the problem is and who needs to solve it. When the help desk determines that the local agency IT must be involved to resolve an issue, it's responsibility of your users to contact your respective IT departments and get that going. The third type of issue that the help desk deals with are hardware problems. The state WIC help desk is responsible for microprinters, the signature pads, and state-supplied computers. I say state-supplied computers because some of our agencies provide their own computers. I don't believe that's the case for any of you people. But you can always start with reporting a hardware problem to the state help desk immediately, because we can determine what's the next steps to be involved, whether we need to solve it or your IT does. If local agency IT needs to get involved, it's best to set up an appointment, a time that they can help work on that issue, and then our help desk and the local agency help desk works together. This sometimes can take a day or two to schedule that appointment and get the issue resolved. So the quicker you report the issue, the quicker we can get it resolved. If the problem is caused by equipment malfunction, then the state WIC office will send a replacement unit, that's a computer, signature pad, or microprinter. And I just wanted to say in passing also that loading other applications, such as Microsoft Office, antivirus applications, and local agency specific programs is permissible. However, it is the responsibility of the local agency to purchase, install, and maintain those applications. Our help desk cannot help with those. The second topic I'd like to talk about is synchronization and network downtime mode. The first thing I'll talk about is network downtime mode. In the event of an internet outage or performance issues at the state data center that prevents a clinic from operating normally, a clinic may switch to disconnected operations. This disconnected operations is called network downtime. We call it NDT mode. When a clinic switches to NDT mode, the clinic WIC computers are connected to the NDT computer located at the clinic, instead of the central database, which is located at the state data center. Additionally, the clinic is locked out of connected operations. When this happens, the clinic staff, WIC users, can continue to see clients and print checks in NDT mode. However, once in NDT mode, the clinic must operate in NDT mode for the remainder of the day. When clinic operations are ended for the day, the clinic NDT administrator, which I'll talk about in a moment, connects the clinic server to the internet and initiates a full synchronization. And we'll talk about synchronization in a minute too. The importance of the full synchronization is that it uploads all the change data from the NDT computers to the central database, and demotes the NDT computer back to normal workstation status and releases the lock on the clinic data at the central database. The next morning, all clinic staff would just log in as usual and connect to the central service database. Now, that's just an overview, and what I really suggest that you guys do is go to the program manual and look at Section 8, Clinic Services, and towards the back there's some sections that talk about NDT mode and synchronization. What's very important is there's a section called Important Considerations when switching to NDT mode, and I would recommend that you become very familiar with those considerations. So in order to prepare this computer at the clinics for the eventuality of NDT, we have to synchronize each evening. And so this process of synchronization keeps the data on the clinic computer current with the central database. This synchronization process downloads data from the central database to the clinic server later in the night. Clinics are required, and this is important, clinics are required to run synchronization process at the end of each clinic day. Normally this is only a download, so only half the synchronization occurs. However, if your clinic was in NDT mode for part of the day, there will also be an upload component of the synchronization. This upload component moves the new data created that day to the central servers. The upload component starts just as soon as synchronization is started, not later in the night. It's really important to ensure that your clinic has a successful synchronization each day so that the most up-to-date clinic data is available at the clinic in the event of an outage that requires your clinic to switch to NDT mode. For more information, contact the help desk for detailed instructions on how to perform synchronization. Now, I would imagine in a lot of your clinics, you already have somebody that's performing synchronization, and this person is known as the NDT administrator. The NDT administrator always performs synchronization on the clinic server because that is the computer that contains the local copy of the clinic's database. Therefore, the normal computer that the NDT administrator uses should also be the clinic NDT computer. As always, the NDT administrator may contact the help desk for detailed instructions on how to perform daily synchronizations or any questions they have. And again, I'm going to emphasize, please refer to Chapter 8 in the program manual. Look at the sections called Synchronization of the Clinic Server's Database and the section called Switching to NDT Mode. There's a lot of detailed information in there. The next subject I want to talk about is the secure conference. Yes, go ahead.
Manual in front of me. What does NDT stand for?
Network downtime.
Okay, thank you.
The next section I want to talk about is Secure Compass User ID form. And there seems to be generally some confusion about this form, and so I want to talk about it a little bit. And there's really two purposes of the form. The first purpose of the form is so that the user signs it, so they're agreeing to certain stipulations and practices and policies to help us keep our data secure. So that's why we ask the user to sign the form. We also ask that the user's manager, typically the clinic manager or WIC director, signs the form because they are agreeing that that particular user is to have certain levels of access to Compass data. Now, you use this form for new users, changes to existing users, and that's usually where we run into problems, and staff separation for WIC. So as an example, if you have a WIC educator who takes on a new role, let's say as a LARC, and they need additional levels of access to Compass, you have to fill out the form again and sign it, and then send it into the help desk, and we'll change the levels of access at that time. Once the form is processed by the state help desk, an email notification is sent to the end user and the person authorizing the change. Now, twice a year, we have to perform what we call an access level audit. When these occur, we will send you a list of all your users for your local agency and their current access levels, and we will ask you to confirm their levels of access. Or if they're no longer working there, let us know that they're not working there. If the level of access is incorrect and you want it changed, you also do it by filling out that secure Compass user ID form and sign it and submitting that along with this audit list that we're sending you. You can get more details on it if you refer to Policy Letter 2 in your program manual under the Policy Letter section. If it's not there, ask your nutrition consultant to send you a copy of the letter. The next section I'd like to talk about is the importance and the need to capture participant signatures. The WIC program captures a variety of signatures throughout the certification process. Some of these signatures include the signature capture on the certification panel, food benefits, breastfeeding equipment panel, and participant violations panel. Capturing a participant's signature on the signature pad is important because it means the person has acknowledged such things as the Colorado WIC program's rights and responsibilities, that the participant has received their checks, that they're aware of their participant violations, if there are any, and that they understand the rules around breast pump loan program. Because of equipment malfunction or maybe some other things that are going on in clinic, a signature may not be able to be captured. In these cases, you complete the appropriate form, obtain the endorser's signature, and scan that form into Compass. If it is an equipment malfunction, contact the help desk immediately. Now, if you refer to the July-August 2013 WIC news, you will find a table there that lists the appropriate form for filling out for the different types of missing signatures. It's in a little table, 1, 2, 3, 4, 5 rows in that. Otherwise, check with your nutrition consultant. The next topic, and a very important one, is checking the MICR line. The MICR line, well, let me first start by saying MICR stands for Magnetic Imaging Character Recognition. This is the line of text that is on the bottom of each of the FIs in a funny looking font. The information contained in this line is the routing information, the bank account information, and it's used for processing checks through the banking system. Bad MICR line, and I'll discuss what that means in a minute, but bad MICR line disrupts the automatic handling of checks and creates a lot of manual work for state office and bank staff. Oh, okay, sure. Thank you for bringing that up.
I'm not really sure which one.
No, I was kidding. Can you bring up so I'm going to go into the different kinds of MICR line falls. Could you bring up the new employee training when it shows the 2 different falls next? I don't really need to see the checks.
New employee training.
Well, MICR line, correcting MICR line, I don't know what the name of it is.
There is another slide that has the correct and incorrect.
Well, I have a different check.
You didn't get the third one?
No.
All right, well, let me just go on and try to describe it. There's one. So that's the first one. So really what you need to get out of this is that as checks are being printed, staff needs to get in a habit of looking at that MICR line. There's several things that can go wrong with the computers and the printers that will cause the MICR line to start printing incorrectly. And we want to catch that as quickly as possible, call the help desk, and we'll get it resolved. The first one that's being displayed now is the MICR line is very small, and it's in what I call human readable font. It's very easy to read, it's very small. A lot of times this is caused because the clinic staff has selected the wrong printer to print the checks. So it can be fixed very quickly by selecting the correct printer. If that doesn't fix the problem, then contact the help desk and they'll do what they need to do to get that fixed. The important things about this is these checks will still pass through the bank. So any FIs that have already left the premises do not need to be recalled. So it's not as critical of an issue. Now, the second thing that can happen to the MICR line, and Linda's bringing that up for us now, so I'll give her a second. Well, that's the correct MICR font there. You don't have a third document there that shows.
Third one is this.
Yes, that's it. So we call this MICR line printing gibberish. It's just a lot of letters and numbers and characters. Can't really describe it any better than that. Now, this is a big problem because these checks will not pass through the bank and they will be rejected. So if you see this problem develop, stop printing checks immediately. Try to recall checks that have left the premises and reprint them once the problem's fixed. And of course, call the help desk immediately and we'll get this problem resolved for you.
Can I interject one
Yes.
thing on checks? The MICR print, that ink for the printers is only good for 1 year, regardless if you print one check or you print 20,000. That MICR ink has to be replaced every single year. So please make sure you include that in your budget when your costs that you should have for the entire year. And there's information in the program manual about how to order a new one, but just keep that in mind.
And those are expensive cartridges too.
Yeah, you can't use regular ink in there.
The next topic I want to talk about is hardware and inventory. State office is required to perform a physical inventory of all computer equipment every 2 years. We here at the state office conduct the inventory on even years, starting in July. So the next one will be in about a year from now, July 2014. What we do in this case is we send to each local agency a list of the computer assets that we have on record. And we ask the local agency staff to verify the serial numbers and asset tags that are on that list and make corrections as necessary. Send it back to us. The local agency, you would send the revised spreadsheet back to the help desk. And like I said, we take 4 to 6, 8 weeks, something like that, to try to get that done. The last topic I want to talk about is intra-state dual participation. The policy is that all clinics must run the intra-state dual participation and resolve those listed on the record as possible dual participants. Intrastate dual participation is assessed through the intrastate dual participation function in the operations functional area of Compass. Clinic supervisor or designated WIC staff members should run the report at the end of each month. WIC staff must verify and compass whether each possible dual participant in that clinic is actually a dual participating or not. When another WIC clinic is involved, communication between the clinics may need to occur in order to reach mutual agreement. In Compass, when a person is initially added to Compass, an immediate dual participation search is conducted by the system on the dual participation pop-up. If any names show up in the list indicating possible duals, staff persons are required to determine whether the person is enrolled in another clinic. If the person is enrolled, they need to back out of adding that person and then transfer the person from the other clinic into their clinic, continue working with that person. There's really 3 types of situations that can occur in dual participation. The first is simply it's not the same person. When it is determined that the 2 records are not the same person, the matching record must be resolved. What that means is the next time that potential dual that really isn't a dual won't show up. You do this by marking the resolve checkbox and selecting no dual or duplicate option in the reason drop-down list. The second thing that may occur is it's a true dual participation. When a participant is truly a dual participant, WIC staff must follow the prevention and management of endorser misuse procedures outlined in the program manual. Staff must counsel the participant on the illegality of dual participation. The last thing that may happen is there's duplicate records. So when you, in that case, there's a process for sending to the web help desk a request to merge records, and that is to take one record and a participant and add it to another record. The instruction, and that can get kind of complicated too, and the instructions for tracking these duplicate records can be found in the program manual section 8, Planning Procedures, Interstate Dual Participation. So refer to that for the instructions on how to do that. That's all I have for today. So if there's any questions on any of those subjects, now's the time to ask. That's because I confused them all. They don't even know what to ask.
So, Mitch, maybe you could just mention that this is the form that they should use if they do have duplicate records, and basically this could happen if maybe they put one person in under Mary Smith and the other one under Maria Smith, but it's really the same person, and somehow you misspelled her name the first time. So then the help desk, once you send this in, and the help desk can merge those records.
And these are just mistakes that and you're right, Kathy. These are just mistakes that happen in clinic. And sometimes you won't even know that particular month that it happened, and it'll show up the next time that participant's in the clinic, and then you find these two records, one under Mary Smith and then one under, Mary Ellen Smith. And then you say, oh, well, this is really the same person, but the last clinic visit is under this new participant, where all the other clinic visits are under the original participant record. And so then we can merge those records and get that all straightened out. So you fill out this form, you send it in each month, and typically we don't need to contact you, but in some cases there may be some questions, and the WIC help desk will contact you and ask some further questions before they make a determination on how to merge the records. Is that better?
Yes, and please don't put anything else in their name. Sometimes staff will try to put like a Z in front of a name or something, so it alphabetizes differently, so it's not pulled up. But just leave the record the way it is, send it in, and then we can merge them.
And we understand that that can happen. It happens on a regular basis. We try to reduce how much that happens, but it's really something that we expect to happen every month. So.
Elizabeth from URA, the hardware inventory, is that something that you guys roll out to us, or do we need to mark our calendar and do it, remember ourselves?
No, we'll send, next July, we'll send an email along with the list of assets that we have on record for your agencies, so you don't have to remember anything.
And if our IT guy has questions just in general about how this operates, I don't know if we're doing like the synchronization correctly. I'm going to check to make sure. You can just call the help desk.
Well, it wouldn't be your IT guy. It would be your NDT administrator, somebody, a clinic staff member that's doing that, because it's controlled through the application.
Okay. Yep. I'll talk to her about it.
Okay. Other questions? Hearing none, then I guess we can move on. What's next, Kathy?
It's just some time now for questions and answers. Are there any questions for Katie? Any budget questions, fiscal questions?
Do you want to sit here?
Katie, I wonder if you could clarify a little bit at the end of the year, the money does not roll over to the next year.
Correct.
So if not used,
we give you an agency budget every year. Because we award the funding through a funding formula, we don't expect you to send us a budget. We leave that up to you to spend the money appropriately within your agency, following the guidelines that we have. If you do not spend all of the money by the end of the year, what's left over will roll over into our pot of funds to be reawarded for the next year. So it doesn't roll over to your agency specific. Does So there's been confusion in that in the past.
Where are we in the 5-year cycle? Or it looks like.
Oh, we just sent out the first contract in that 5-year cycle last year. So this will be our second year of that.
Okay, great. And I do have a question. I know that our WIC coordinator sometimes at the end of the year, when we have funding set aside for food allocation, she sometimes purchases food for Thanksgiving, types of food where those who qualify can, and I'm just wondering if that's okay.
No, food purchases really aren't allowed. If you know, there are occasions when food could be purchased for a meeting. If it was like an all-day training where people are not able to get out of the building, then buying a small amount of food, you know, so everyone has lunch is allowable. But in general, it's not.
Don't talk to her about it. I'll see if I understand the concept of what she rolled out. It may be okay based on the manual. So
Sure.
okay.
Mitch, I wonder if you could clarify a little bit about the other forms that locals have to submit, and that is the biennial access level audit, and so it's verifying that these are the secure users and that these are the access levels that they have to the system. I think you kind of went over it.
Went over it, yes, and we do that twice a year.
Maybe spend just a little bit more time on it. So they need to review and make sure that this is the correct functionality and that those staff still are employees and they need to have public access.
Yes, I think that the place to start with that is to read policy letter 2. I think it goes into quite a bit of detail about that. But what we're trying to do is to make sure that we keep the access level for all employees accurate and up to date. So one of the places we get in trouble and is agencies forget when somebody leaves employed to notify us so that we can, you know, delete their access so they can't get access to Compass. That's one of the things. The other one is it's not forgotten. Is, as an example, if a WIC educator takes on a different role, let's say like a LARC, they're going to need different access to different screens, and so we'll give them that. Now, if later on they are reduced and they don't have that role anymore as a LARC, and you don't tell us that, they will still have access to those screens. So that's what we're trying to do twice a year, is to reconcile the access level for each employee with what they're really doing at the clinics. And this really came out of an audit finding, and so we're required to do this now. And I don't know, does that explain it better?
That's perfect, thank you.
And we'll send we send a list of all the users with their access levels and have you review it and sign off on it and send it back to us. And if there are changes, you fill out the secure user ID form, and then we make those changes.
And that secure user ID form is found on our website.
It is, and I failed to mention that thing.
And we had a picture of it up there earlier. And once it's filled out for an employee, then if there's other changes, they could just make those changes on that same form, like the initial, and send it in. Like the person has left, as they are terminated, then the director can just add the updated information and send that same form.
I'm not certain
Or do
that
you want a new one?
I want a new form, because there's little check boxes on what you're requesting, like new user access and separation from WIC. So you have to fill out a new form and check the new box.
So they should fill out a new form?
Yeah.
Okay.
And we keep all those signed copies on file because that's an auditing consideration also for us.
Okay, any other questions? Okay, if none, then we'll sign off. Thank you so much for joining us.
Thank you.